Hi, everyone, and welcome to our very first episode of Wound Care Pro with nurse practitioner Anne Walsh. We're so excited to kick this off. This is going to be a weekly series with nurse practitioner Anne Walsh talking about wounds, allowing you to ask your questions, whether you're a patient, a clinician, or a physician, because she has an amazing app that she created called Wound Care Pro that is available in both the Apple App Store as well as Google Play that can be downloaded. It's just $4.99, and it gives you the instant information at your fingertips, the most up-to-date information that you can find on advanced wound care. And it really helps nurse practitioner, and because there's such a shortage of wound care professionals out there. And that was one of the reasons why you ended up creating this app to democratize access to wound care information to help improve, especially the amputation rates caused by improperly cared for wounds. So let's start off with, I should say hello first.
Hello.
I go right into it. And let's talk about just some of the gaps that you find in proper wound care.
Yes, I mean, there's just being the shortage of specialists, like you said, a lot of folks out there are overwhelmed when patients with more complicated wounds come to them, and they're not really sure where to turn. And they're not sure there's such an amount of, supplies out there to wound products, which ones to use and how to use them properly. And, people living longer, more complicated wounds, they may have a number of wounds, pressure injuries and a diabetic foot ulcer and a vascular wound. So you got all of them in this one patient, and it could be overwhelming if they don't have the support of somebody who does this all the time. I've been
What are some of the,
specialized in wound care for almost 24 years. So it's,
and so what was that actual catalyst where you finally said, enough is enough? Enough is enough. Was there a specific situation where you were just like, okay, I got to do something about this. I don't know how to create an app or anything else, but I got to do this.
yeah, I mean, I've seen so many patients over the years, thousands upon thousands in their homes. Patients come referred to us. I may see them in the nursing home even. And sometimes you just see this such inappropriate wound care. And it gets overwhelming trying to, like educate so many people. And it just had try to get this tool in their hands. And oftentimes nurses, nurse practitioners, physician fellows rotate through our program, and they always say, we'd love to learn more about wound care. So they want to learn, but it's just like, how do we get certified ourselves, or how do we find this information? And what do we do when patients come to us? So they want to help, but it just, it's hard to get that specialist. It could be a hospital system where there's one person covering the, whole area, and, they'll only see the patients with the most needs, and then everyone else is left fending for themselves.
And so you're like, okay, I just need to do something. And so that's where you created the Wound Care Pro.
Yeah.
So
Yeah.
what were some of the biggest mistakes? And even now, what are some of the biggest mistakes you see some of these clinicians and physicians making when it comes to wound care make you cringe?
Yeah, I mean, it's just basically using the supplies wrong. Maybe they'll try to debride a wound that you shouldn't debride until you know what's going on underneath. For example, if it's intact eschar, that black tissue, you don't want to automatically open that up without knowing, do we have enough blood supply to get there? So I've seen that happen, where I've seen the patient, and in that case, you may paint it with betadine, keep this eschar intact until we know what's going on. Next thing, you get a call from the family, somebody else went in and they applied some kind of a debriding agent and just want to open this up. And now all of a sudden it's not healing, there's complications. The person sometimes ends up in the hospital. And I'm like, what happened? Everything was okay. We had a plan in place to figure this out. And, we just see those kinds of things, and just families overwhelmed, and, just prompted me to move on this quicker.
Do you find that some clinicians and physicians don't realize that how quickly a wound can turn?
Absolutely. Yes. Especially if there's poor blood flow. I mean, we had a lady one time went to the nail salon, the family brought her. She was in her 90s with heart failure. And the aggressive foot care that she got actually led to an ulcer. And at first it seemed like a little abrasion. And that was a Friday, by the Monday, it was a full blown vascular wound. We had to get her on antibiotics and try to, get things under control. And she'd still opened. It's healing very, very slowly. But the family didn't realize. They thought they were doing a nice thing for mom, and it just got out of hand.
Oh, I see that all too often. And in fact, this one situation in California stands out. It was a very special family to us. And the son came to us and said that they thought they were doing something special for mom. She went and she got a pedicure, and it was literally just one nick in the big toe that put her in the hospital, and she never left.
Yeah, yeah,
And it was really sad. And that, she didn't have enough blood flow to get there. Then she had improper care, and they didn't revascularize right away. I mean, it was just this whole it set off this domino effect that
yes,
started with mom went and got a pedicure. And so now this family's like, don't ever, if you have a family member that has any risk factors, do not go to a nail salon, go to a podiatrist and
yeah.
go get those nails taken care of. Do you find, because I see this all the time as well, as I do see, you mentioned that the doing the debridement, before making sure that there's adequate blood flow, you see that happening. That is a huge mistake. And I still can't believe how many times I have a patient coming to me. I mean, it seems like almost every week where a patient came to me, they got debrided. They don't even know that they have peripheral artery disease, which
Right.
is the restricted blood flow. And I mean, more than 35% of patients who have called our Lifesaver hotline on deck for amputation don't even know that they have PAD. They have no idea it is a blood flow issue, due to blockages in their arteries. And so it's frustrating to me, and I don't understand. Maybe you could explain to me, why is it that still so many wound care professionals and podiatrists do not know to check the blood flow?
Yeah, I don't know. I mean, it's scary, really, and even to seeing a diabetic person and callus on the foot and that sort of thing. That sometimes other health professionals going into the home or wherever don't even take the sock off, look at the foot, and just say, this could turn into a big problem. Let's try to catch it early. And then you get the ones where all of a sudden things are being debrided and getting out of hand. I don't know. It's just more education is needed, I guess. I don't know why it's still happening, but that's what prompted me all these years later. When I first got out of nursing school, I didn't know. I was educated, great mentors, and I'm so surprised here we are all these years later, 24 years since I've been certified in wound care from Emory, that I'm seeing the same things. So a lot hasn't changed. That's why it's like, even though we do courses, we do publications, but it's not getting to everybody. And that's why I thought an app at least would be a way to get into the hands of a clinician, at least as a resource for them.
Yep. And, since this is going to be a series, I can sit here and ask you questions all day long, because I
Yeah.
have so many patients. I have more than 12,000 we work with around the world. And so I could bring you lots and lots of those that I have questions about. But I want to open it up and make sure that everyone realizes, when you do watch this, that this is going to be weekly, and it's going to be your show, you, the patients, even physicians and clinicians. What questions do you have about wound care that nurse practitioner Anne Walsh can answer for you? We did have one after having you on the Heart of Innovation radio show, who did write in, and she is even here with us right now, that she had sent in pictures of her wounds, and she wanted you to take a look. A little bit blurry here, but you could probably just get an idea of what she's dealing with on her big toe. And she's just wondering what your thoughts are, on some questions she should be asking her podiatrist and wound care professional to improve the situation, with this wound in her toe.
I mean, just immediately looking at it from that purplish color and just like her toenails and the shiny skin, and you don't see any hair there, I'm immediately thinking arterial problems. And I believe you had that workup, but wouldn't hurt to go again and see what's going on. Why is this wound not healing? And I know you've tried the honey products, I believe you said, but I would think like honey, just to help, it's antimicrobial and help clean up that yellow necrotic slough tissue there. But it
Mhm.
just seems like something else might be going on with the blood flow.
Yeah. And that could be a problem. We were talking with nurse practitioner Deidre Arms about nutrient deficiencies that, we find with a lot of patients, and one of them being iron, and iron being an issue in getting oxygen, to absorb, right?
Yeah, absolutely. And if you don't have enough blood flow, then even the nutrients can't even get there if that's impeding the blood flow. Sometimes even certain medications can open up the, and help the medication get the blood flow through there as well. If you don't want surgery, or if surgery is not an option. I'm not sure, if we went down that road as well.
Yeah. And so anything, in the meantime with a wound like that until she can get her blood flow restored, any advice on questions that she could be asking her wound care specialist or podiatrist to just make it so it doesn't get worse?
Yeah, I would think something antimicrobial, like I mentioned, the honey product, because are at high risk for infection with these kinds of wounds, and that could spread, and then it involve more of your foot.
Definitely. Marcia, I hope that answers your question.
Yeah, I actually ordered some Manuka honey, medical grade Manuka honey yesterday. So I'll be
Good.
getting it tomorrow. I wanted to ask you about the routine I go through to clean my toe, and the balance between too dry and too wet. In the morning, I've had it covered, and I uncover it with gauze, nothing with self-adhesive stuff, because I just peel skin off my toe. It's just gauze wrapped around. And I soak it with some saline solution just to clean it off. And my question is, should I be gentle with that, or should I try to slough some of the dead skin away from it?
Yeah, I would be gentle with it, and I would not soak your foot. I mean, it's okay to cleanse it if you're putting it on the gauze or using a spray bottle. Give it a good cleaning and pat it dry, but I wouldn't actually submerge your foot and soak it for long, because that could spread anything local,
Yeah,
spread through the foot.
I'm not soaking my feet at
Good,
all at this
good,
point. I'm
good.
kind of afraid to get it too wet.
Yeah,
But so then after I do that and I dry it off, then I apply this cream that I did get from my podiatrist. And it's a handcrafted prescription. She had to write it out, and this company mailed it to me, and it has two main ingredients in it. And I need to read this little piece of paper here if I can. Nifedipine
okay.
and pentyloxylene. And they both say that the first one that is a channel blocker that helps improve blood flow to the area. And the second one helps improve the absorption to enhance healing. So I've never heard of either of those before. I've used lidocaine cream I use, but I just wondered if you had ever heard of either of those two ingredients before.
I mean, I heard of them, lidocaine is just for pain. These medications are, compounded at the pharmacy special to hopefully try to get the blood flow to the area. I don't know if there's much out there on how, well they work, but have you tried it at least for a while?
Yeah, I did get
Oh,
it. And honestly, it took me like 3 weeks to get, and
right.
I've been using it for about a week now, and I do notice an improvement in the pain level of my great right toe.
Oh,
So
maybe
So if
because
you're
it is
noticing
getting a little more blood
improvements,
flow.
yeah,
so
maybe I wouldn't mess with it then if it's working for you, and see what whoever's prescribed it thinks. Do they take a picture and compare to how it's
oh
looking?
yeah, they took
Yeah.
a picture, and she actually tried to clip off just a little bit of stuff, trying to looking like it was going to grow back in, and it was so painful that I wailed. I
Wow.
sobbed out loud, and
Like, no, I'm done.
kind of freaked her out,
Yeah.
She
Well, it looked like you had an
so
ingrown toenail in the
she
corner
got
a
a
little
little
bit that she
unsettled.
feel.
Well,
Yeah.
yeah, and that's what started the whole thing, is
Right.
that after I had a stent placement, an iliac stent placement, the interventional cardiologist said, that's all I can do for you. If you have problems below the knee, I'll refer you to my husband. He's a vascular surgeon. So I
Yeah,
went
but we
to
ended up
him.
getting her to another one. Yeah, and we got her to another one, and he
Yeah.
restored flow. But I'm wondering, if it's kind of a last mile problem. They got as far as they could into the foot with the blood flow, but maybe and we find this, and we're going to be talking about this next week, which is, sometimes, especially in diabetics, you can have that last mile problem with the capillaries, right, Anne?
Right, absolutely, absolutely. And how is your
Thank
sugar? Are you keeping all that under control?
Yeah, I'm not
Okay,
diabetic. I eat well.
good.
I have CAD. I don't have high blood pressure. I practice Tai Chi and Qigong.
Oh, wow.
So
Yep,
I'm doing
she
what I
does it all.
can.
Yeah.
I'm doing everything I can. I'm just like, you know,
Well,
I
thank
wish
you
it
so
would
much,
heal.
Marcia. Yep.
Yep. Thank
And
you. And
we'll definitely keep us up to date on that. We want to see if this cream keeps on working for you. So definitely keep checking in with us, and we want to hear, because that could be something that could be helpful. And Anne, I don't know if it's something that, are those ingredients something that's available over the counter, or is this something that patients have to get probably each one individually
Probably from the pharmacy that
from the
specializes in
pharmacy?
compounding, because these are things
Yeah.
that people take by mouth, and they're trying to put it. Because sometimes you even hear of Dilantin that's for seizures. I've heard of some people using those towards wounds. I haven't, but there's people try everything just to try to see if we could bring those medications directly to the wound, if it could
Mhm.
increase the blood flow. Even the nitro paste you could put for angina. I've seen back in the day some people putting that around a wound to bring the blood flow, to vasodilate those vessels. I haven't personally tried it, but there's stuff people go off label. Let's just try everything. So see if that helps you. Definitely let us know.
And anyone else have any questions? We have a few more minutes here of time with nurse practitioner Anne Walsh. And of course, we're going to be back every single week, and we're going to allow you to, we'll have a topic du jour, of course, like next week. I think we're going to be talking about some diabetic ulcers, and we do have a question. Wow, coming in already. And this one, Kristen, I'm not sure if you wanted to ask nurse practitioner and your questions yourself. If you want to go ahead and do that, go ahead and unmute, and you can ask each one at a time, but we'll start with the first one. I don't hear her, so I'll go ahead and I'll ask the first one. It says, we all know protein is key with healing, but does too much lower bun and raise creatine levels? So we talk about, and that's an issue with people who have chronic kidney disease, and especially ESRD. We do have an issue where they do need to balance the protein. So probably what the question really is that, for patients, especially with CKD and ESRD, protein is definitely a key to healing. But for people, what's the balance for people who have these diseases where you have to lower the amount of protein you're eating?
Yeah, I mean, you may have to check, see what your labs are to see exactly where the numbers are, and a registered dietitian would be a good person to speak to. Maybe even the NP that speaks about nutrition, just to help balance that. Because while you do need it, you don't need too much. In your case with the kidneys, that you're going to cause more problems.
And her second question, is I think more for, I don't know if you want to take it, great, or else we can throw it to nurse practitioner Deidre next week. But with blood flow issues, should she avoid multivitamins that contain K, since K tends to clot blood? And we did address this actually in another segment with nurse practitioner Deidre before, and that was something that she suggested. You really do need to have that conversation with your doctor and make sure that because each person has such an individualized presentation of disease and very individual
And potassium is one of those
blood
ones you don't want
issues.
to play around with. It's a specific number. It's supposed to be between this and between that.
Yeah.
Too low is no good. Too high is no good. So you want to definitely check with your provider.
Yep, definitely. Okay, and Frank, do you want to jump in and ask your question of nurse practitioner Anne?
Sure, thanks, Kim. Hello, Nurse Anne. My question involves foam padded bandages versus the over-the-counter kind, which happen to be not as cushiony. My wound is at close to the tip of my residual, so it looks like I won't be wearing my prosthetic for a few days while the wound heals. All I get from my physician are very large padded bandages from the pharma companies. So when I'm out of those and I have to go to my local drugstore they're not available apparently in foam padded formats. What's your opinion on getting by with thinner pads until I see my doctor?
I think that's fine. You could pad it with whatever you have. I mean, we use a lot of the silicone foam dressings that are nice on the skin and they could stay on for several days, but they're costly. So I don't know what the availability at your pharmacy is. When I work in home care, we could order it to be delivered to the patient, and but it's each one can be costly, but they can stay on up to 7 days. But I don't know, you might want to check yours more frequently, and sometimes you could lift it up, look, and gently put it back down to get more wear out of it. But anything that's going to afford you some padding, so you're not putting pressure on that area, is good.
All right. Thanks again.
You're welcome.
Have you tried going to Amazon? You can't get them off Amazon. Sometimes you can find things on Amazon that you can't typically find. And also, I've even gone on eBay. I know that's crazy, but I've actually gone on eBay and I've found additional options such as that. When my dad ended up with his big wound when he fell and he broke his hip and he had the surgery to replace his hip, I was having trouble as well going to the local pharmacy, and I ended up finding some fantastic foam bandages from off eBay. I know you always have
Yeah.
to be careful, but it was a reputable seller, and so I was able to get them there at actually a
Well,
pretty good price.
well, my wife is the Amazon account holder, so I'll be sure to check with my wife in a few hours. Thanks.
Oh yeah, you definitely get them from Amazon. Sometimes it takes a few days, but now I think we're still in Prime Day, so maybe you can get them quick.
I better
That
hurry
would
up.
be that would be great. Thank you so much. I hear this a lot, nurse practitioner, and when it comes to folks who've had an amputation, that they end up with issues involving their prosthetics. Do you have any sort of advice for some of the folks, because they can't get into the person to actually fix their prosthetic, or they can't get a replacement quick enough, and so they have to kind of fudge it in order to prevent any sort of rubbing. And if they do end up with the rubbing, they do end up with the wound, and then they're stuck sedentary.
Yeah, no, it's
And
a
it
vicious
becomes
cycle, especially if you get any kind of
exactly.
edema,
That's me.
that's causing the fit not to be so precise, that to try to keep on top of that. Yeah, and it's definitely hard. I've seen a lot of patients with that, and you got to do the padding so you're not rubbing, and just I had one guy, the bone had to even be shaved down because it just kept rubbing in the same spot over and over again. Like that was the type of surgery he had, and the way it healed, it was a bony prominence right there. No matter what he did, it was rubbing.
Yeah. So probably layering of that padding and those bandages to make sure so that you can get that prosthetic on and keep on your feet.
And sometimes we have
Key,
physical therapists in we're lucky to have that go to the house, and sometimes they have lots of ideas and tricks of the trade too.
Fantastic. Well, we have surprisingly come to the end of our 30 minutes for this session. I want to just wrap up, make sure there aren't anyone. We have quite a few people that are in our live studio audience right now, and I want to make sure, and I'll just say first name. So if you want to just go ahead and unmute in case you do have a question. I know there's Diana on here, Marsha's on here, Brenda is on here, Kim. Anyone have any questions about wound care or healing before we jump off, or else she's not going to go away. She'll be back next week. So I promise.
Hi, I have a quick question. It's
Yes,
Kirsten. Lawnmower kind of stuff. Acetic acid, a vinegar water wash. Our podiatrist suggested it. It was too painful for a while, but I just kind of mixed a little bit with just like haphazardly, just like with a little bit of white vinegar, and it was amazing how much came off. It was how much is too much? Should I wait a couple days and do it again? Is there like a formula? I'm kind of lost online.
Oh, where are you using it? To your foot?
Oh yeah, it's my mom's toes and dorsal, but mainly
Yeah, just be careful it's not too strong and too much of an antiseptic. Short term, and then I watch because you don't want to over dry her skin, and then cause more problems with peeling of the skin and all.
She's got like weeping, gangrene, oozing stuff. So the weeping.
Oh, is it black gangrene?
Yes, yeah.
Oh, with that, I mean, try to keep that dry typically, because you don't want to convert it from, hopefully dry gangrene into wet gangrene. So those usually situations we try to keep it dry and paint it with betadine if there's no allergies.
Okay.
Um,
We've been doing
because
that and it's like falling off like every couple days, another little piece. And I'm seeing like real toe under there.
yeah, because
Um,
the acetic acid is antimicrobial, but it's
okay.
moisture, whereas the betadine is antiseptic, but it's a drying agent. So any kind of moisture is going to soften that, and sometimes when you get the maggots and you get more problems. So just be careful.
Is the
You
acetic?
want moist wound healing, but when it comes to gangrene, you want it to keep dry.
Yeah, we have like both. We have mix. We have wet and we have dry. We're trying to keep the dry wet, But you're saying gangrene, keep dry until it falls off like an umbilical
Keep dry. Yeah, sometimes when we see toes, they'll auto amputate because it's like, but you don't want it
that's what
wet.
it's doing. Yeah, the one is
Yeah,
doing
we
that.
even had a patient one time that she was doing the betadine, but somebody came and put a moist dressing on top of it. Next thing we got the phone call, there was maggots, everything was, and she ended up, back in the hospital. It was the odor, everything softened up. And before
Yeah.
that, it was just dry eschar, dry gangrene, and one toe auto amputated.
Okay.
And did
All right.
you have the blood flow restored? Were they able to get the blood flow
At
restored
that
to
particular patient,
Yeah.
by the time they came to us, it was complete end stage. The leg, from the toes all the way up, it was spreading. Started at the toes, then it was the ankle, completely dry gangrene, and they
And that's
refused
something
amputation, so.
and that's something you want to keep an eye on, right? You want to make sure, should she draw a line or anything just to make sure that if that gangrene or if I mean it does turn pretty quickly, so it's good to keep an eye on it.
Definitely keep an eye on it. Yeah, yeah. If there's any odor or antibiotics might be needed, or but the betadine is usually the way to go with those ones.
We did just recently incorporate a compounding powder which has Cipro, Doxy, and an antifungal.
That's good.
One of the
Powder's good.
and
There's
that's
powder
dried it
drying
out.
as well to keep it
Yeah.
dry, to manage the drainage with the powder is good, and then the dead tissue, the betadine is good there because it's dead tissue. You're just trying to keep it from getting soft and, like I said, malodorous and spreading.
Okay. All right. Good. Then that's
Kirsten,
good. I wasn't.
in her case, did she get blood flow restored? Did they get down into that into the
Yeah.
below the knee arteries and into the foot arteries?
Yeah, she did. She did a few times, and this was it clotted, the scar tissue. But our vascular guy, who you recommend and we love, went in there, took the scar out in December. But because of that critical limb started coming back again, that weeping, and she still can't elevate her legs. So that weeping's finally slowing down, and everything's drying up. And she's a little more mobile. She can kind of
Okay.
wheel
We might
around.
have you can I go ahead and message me, and I don't, when was the last time that you saw the vascular doctor?
Oh, he's like on top of us. So we do virtual every 4 weeks now. So we're good. Yeah,
You're
we love
good.
him.
Okay.
Yeah, we're
Oh,
good.
good. And I imagine this person goes all the way into the pedal loop of the foot. I always find there are a lot of patients out there and that end up nurse practitioner, and where the doctor says that, well, we've done all we can do. We've opened up the arteries and nothing more can be done, but they don't tell the patient that they've only treated to the knee and that they have the below the knee disease and they have below the ankle disease into the foot. And they just don't say anything. They just say, well, you're not getting blood flow there, so we can't open it up, so it can't be done. And the patients have no idea that there are doctors that they didn't even try below the knee or into the foot. And that is a major issue, or that it even can be done, or it's even a thing. So what we try to do is we try to get the word out there that if you do have a wound like this and there is that limb threatening ischemia, that what do you have to lose but to go and have a doctor at least try to open up those arteries. But you've got to ask the question, how far did you go? How low can you go, doc? Right?
Yeah, right. Before it's
into the
too
foot.
late.
Right, exactly. So it's a little frustrating, but anyone who's watching this, just make sure to ask your doctor, did you try to open up the arteries below the knee? I'll even find that they've opened them below the knee, but then they just don't believe or don't know how to open up the arteries, or don't think it's worthwhile to open up the arteries into the foot because it's not durable and it won't last long. Well, the point isn't for these procedures to make anything durable. That's not what it is going to lead to a revolving door procedures, but the whole key with these procedures is to heal that wound, get the blood flow to the wound, get that wound healed so you can get back on your feet and start walking and building those collateral vessels. That's all it's for. You may not need another procedure again once that wound's healed if you can get on your feet and start walking again, because your feet are a great place to start growing those collateral vessels. We see them all the time, don't we, Anne?
Yes, absolutely.
So fantastic. Thank you so much. I just want to, one comment that just came in from Marie. She uses CBD lotion. And so she's never had a wound or sore on her foot, knock on wood, despite having issues with her blood flow. She's in a constant state of CLI, out of CLI, in CLI, just because of her clotting issues. But she takes very good care of her feet, and that is amazing. And that is critical, taking good care of your feet.
Absolutely.
And I think that that would be even just a great show, just to spend 30 minutes just talking about how prevention, right? How to care for your feet. So we have so many more shows ahead. I'm really excited. Thank you for devoting your time, volunteering your time to be here, to answer so many questions for patients and to educate so many, not only through this show, but also through your app, Wound Care Pro. If anyone wants wound care at their fingertips, Wound Care Pro, you can download it. As you can see right behind Anne, you can download it from the App Store as well as from Google Play. But we're going to go ahead and end this session. We appreciate your time, Nurse Practitioner Anne. And I'm assuming we'll see you we'll see you next week. We'll get the time in place. And I think we're going to talk about some diabetic ulcers.
Sounds good.
Thank you so much.
All right. Thank you, everybody. Bye-bye.